IMPARTS has been absolutely essential to our clinical practice. From 2011, we have this amazing system for identifying the mental health problems which were evident in at least a third of our patients.
As a maxillofacial surgeon, I have to say holistic care perhaps is not as high on our priority or as it should be. In terms of our patients with facial deformity, just because they have a facial deformity, correcting it doesn't necessarily address all their problems. They aren't necessarily happy with the outcome. And having the ability to identify other mental well-being issues such as anxiety, depression, or even possible body dysmorphic disorder allows those to be addressed prior to us starting the patient on a complex program of treatment so that they can, when they have the full surgical treatment, be happy with the end result and be able to achieve their full potential in life. And that's probably one of the biggest gifts that we get when patients come back and tell us what the whole package of treatment has meant to them, not just our surgery, but also the utilisation of IMPARTS and the access to our clinical psychologists.
There was a video from a woman called Fiona who was in Graham's clinic, and we used Fiona's story in lots of different spaces, and it was one of the most sort of humbling stories that you can imagine. It was everything that we wanted to say about how IMPARTS could impact somebody's experience of a clinic and also the outcomes. And she was a woman who'd had a fall, and she just talked essentially about how the use of IMPARTS has entirely revolutionised the conversation that she was able to have with her clinician. So I would say that was a highlight. I think also when you talk to staff around some of these issues, and there's a real recognition that actually you can't deal with one mental health side without the physical health side and vice versa. And if we do those two things together, it'll ultimately make for better outcomes for patients. We can make a fundamental difference, and we can make this system, which is absolutely designed around this dichotomy between mental and physical health care, come together if we try hard enough.
That challenge of having a patient comes to clinic, you collect information about their mental health, in real time enters into the clinical record, and you see that during the consultation. So how you embed that in required enormous sort of logistical challenges to get it together. What we've learned from that, we've got to take forward and do it again, because this has been absolutely the most fantastic project.
The thing that I've taken most from IMPARTS is the fact that knowing that we work together as a team is not just us as surgeons, but it's the whole team of clinicians that work together. And IMPARTS has allowed us to know when we call for help from our colleagues and made it easy for that to happen. That's probably the most important take home for me.
Something that I think has really stood out is the way in which colleagues and other clinicians have enthusiastically kind of taken on board some of the training that we've offered as part of IMPARTS, whether that's training for individual teams on the use of the IMPARTS platform, or training non-mental health professionals as part of the 5-day course. I think their ability to connect with what we were trying to achieve as part of the programme and take that forward to really genuinely impact patients' lives is something that stands out as a highlight. Yeah, I think something that I've learned that I'll be taking forwards is the importance of integrated care, ensuring that patients' physical and psychological worlds are incorporated so that they can be delivered care that's important to them and that matters to them to achieve the best outcomes. I think the ability to connect physical and mental health teams in an integrated way will remain an important endeavour, remains something that we need to rise to the challenge of.
Hello. In 2011, I fell down a flight of stairs picking up a cat and sustained a fractured tibia, fibula and a crushed ankle. For the next 3 years, while I underwent treatment, I was simply a female patient with a damaged leg aged 57. Following my referral to a limb reconstruction unit in 2014, I was able to use the IMPARTS programme. I became Fiona again, with a life-changing injury and a team who cared for the whole person. The impacts assessment showed the impact of my accident on my life and gave me and the team the opportunity to benefit from psychiatric review and from cognitive behaviour therapy as part of my recovery. I'm very grateful that I now can look forward and think that I will become Fiona, who will have a life and a future to look forward to. And this wouldn't have been possible if simply my fractures had been the only concern. So thank you.